Hi, and thank you for joining me on the last course of the five-part series of First Responder Resilience. Here we're going to be talking about sustaining resilience. I'm your instructor, Rick Campos. So, what are we going to talk about today? Today, we're going to talk about loneliness. Loneliness has received a lot of attention in the press and with mental health issue professionals over the past few years. A 2018 study by the insurance company Aetna stated nearly half of Americans report sometimes or always feeling alone. It is essential that first responders know that even if they are experiencing feelings of loneliness, they are not alone. There are resources, and these resources can help within your department and in your community. The purpose of this course is to share resources before they are needed so that when they are, you know where to go and help yourself or help someone you care about. With the complexity of the issues first responders face, perhaps the most important thing to address would be organizations that are focused on pointing seekers in the right direction to tailor resources that will meet their needs in a seemingly endless number of categories. Now, these categories include responder type, geographic location, online resources, peer to peer, conference style, seminars, retreats, mental, emotional, spiritual, physical, family, social. You could see the many different categories that we can use to help meet the needs of our first responders. Many of the resources shared in this course are focused on first responders, though it is important not to overlook organizations that are general mental health resources as well. Although many of the resources here are focused on first responders and the specific type of help they need to cope with their challenges, it is important not to overlook organizations that are general mental health resources that may still be helpful to those seeking help. With the complexity of the issues first responders face, perhaps the most important thing to address would be organizations that are focused on pointing seekers in the right direction to tailor resources that will meet their needs in a seemingly endless number of categories. As you can see, the multitude of categories that are presented here. Now, these are here because many people have different needs, and these are the different needs that we may be able to embrace to help our first responders. Although many of the resources are focused on first responders and the specific type of help they may need to cope with their challenges, it is important not to overlook organizations that are general mental health resources that may still be helpful to those seeking help. Now, there may be a perception that asking for help is a sign of weakness. We need to understand that when your body is sick, you go to the doctor. So receiving mental health care is no different. If you take one thing away from these courses, it should be this. Please do not let your pride come before your own well being. We have the Code Green campaign. You can find this at http at codegreencampaign.org. They're a first responder oriented mental health advocacy and education organization. They serve all types of first responders. Now, their mission is to bring awareness to the high rates of mental health issues in first responders and reduce them. They want to help to eliminate the stigma that prevents people from admitting these issues and seeking help. And they want to educate first responders on self care and peer care and become advocates for systemic change in how mental health issues are addressed by first responder agencies. Little history of Code Green here. In March of 2014, one of our founders experienced a suicide death of a coworker. In the days after, she realized many of the first responders she knew had also lost friends and coworkers to suicide. A small group began discussing the stigma first responders face and what they could do about it. Code Green's founders agreed that if there's one thing that first responders like to do, it's tell stories. So they felt that if the first responder had an outlet to tell stories anonymously, they might reduce the stigma. This storytelling project evolved into the Code Green campaign. So in April of 2014, the Code Green campaign was granted nonprofit status in their home state of Washington. This was their first step to becoming a federal 501 organization. In December of 2014, the IRS approved Code Green's application for federal nonprofit status, and the response to Code Green was overwhelming. It quickly became apparent that there was an unmet need in the first responder community. So since 2014, Code Green has expanded its services based on the need of the first responder community. The goal of the Code Green campaign is to improve mental wellness for first responders and also to reduce barriers assessing mental health care. Some of their goals include reducing the stigma around talking about mental health issues, providing education about the signs and symptoms of the mental health issues that we as first responders experience, increasing access to culturally competent mental health resources, reducing financial barriers to receive care, reducing unnecessary organizational and operational stressors, and suicide prevention and postvention. So the Code Green campaign provides education and consulting. In education, they provide conferences, in-house CE events, TED Talk style events, panel discussions, and custom classes related to any first responder mental health topic. And in consulting, they utilize formal and informal consulting, setting up peer support, CISM training, organization of funeral services, and setting up local scholarships. They also help with treatment assistance, such as helping with copays, travel costs, things of that nature. First Help, firsthelp.net. First Help began with the founder, Karen Solman. Writing about law enforcement in 2014, as she spoke with officers and first responders, she recognized the need for the helping first responders. First Help began with its founder, Karen Solman. Writing about law enforcement in 2014, as she spoke with officers and first responders, she recognized the need for helping first responders. Speaking with Okaloosa County deputies Jeffrey M. McGill and Stephen Ho, discussed their dream of forming an organization that would be able to reach first responders across the country. The solution they gave came up with a database, and that database had first responders could access. First Help gives first responders quick and easy access to everything a first responder may need by answering a short questionnaire on their website. Now note that First Help is not a provider of healthcare services, nor does it provide mental health advice, treatment, or care. It is just resources. Resources listed on this website, and they're for information purpose only and not referrals by First Help. Here's some of the questions that First Help will ask you. 1. Do you live in the United States? Do you need immediate assistance? And if the answer to this is yes, crisis helplines are listed. If you or someone you know is in a mental health crisis, do not wait to get help. You or your loved one are seeking help as a result of which profession? Law enforcement, fire, EMS, corrections, or dispatcher? They're going to ask what type of assistance are you seeking? Everything from addiction to suicide prevention. You seek crisis intervention, service dogs, a whole wide array of topics. Are you looking for someone who will also help your spouse, partner, or family? What kind of treatment are you looking for? Are you looking for an inpatient, an outpatient, both, or no preference? And ultimately, what is your zip code? This questionnaire allows the seeker to find resources quickly that are tailored to specific needs, from peer support to mental health care to financial aid. If ever you are not sure where to turn, this questionnaire will point you to the resources that will fit your needs. Once the questionnaire is complete, a list of resources in your area is provided with contact information and a description of the organization. All Clear Foundation, allclearfoundation.org. When someone says all clear, it's assumed that all danger has passed. So the All Clear Foundation is driven to change the harmful stigma and daunting statistics plaguing the first responder profession by creating, convening, funding, and amplifying innovative programs focused on improving their life expectancy and well-being. We have the opportunity to positively impact the men and women who sacrifice so much and shoulder unfathomable burdens in their efforts to keep us and our community safe. The All Clear Foundation is an independent, nonpartisan, and public nonprofit charity. The foundation is dedicated to collaborations and supporting and developing essential resources for all types of first responders. The All Clear Foundation believes that by collaborating and by utilizing technology, they are able to deliver both quality resources and universal support to emergency responders. With the countless organizations working to support first responder, there is still a huge gap in meeting the needs of first responders. Many do not have access to the resources they need, and this may be due to lack of funding, lack of awareness, lack of proven programs, lack of leadership support, lack of access, or all of these. This is especially the case for the 80% of first responders working in remote areas or working as a volunteer. The All Clear Foundation is working hard to close that gap. The All Clear Foundation is dedicated to changing their approach and their focus across 4 areas of wellness. These areas of wellness include mental and emotional health, social and family health, spiritual, physical health. One of the most important focuses for the All Clear Foundation is the impact their work has on the lives of first responders. To this, they have stated clearly that they are governed by impact. The ultimate measure of All Clear Foundation success will be evident by meaningful statistical change. Each of our programs is created with the objective of achieving one or more of the following for first responders: reducing heart attacks, metabolic disease, suicide and traumatic stress levels, or increasing life expectancy, resiliency, family well being, and career satisfaction and longevity. Our approach and methodology for affecting change is progress. Unconventional and sometimes daring, yet never risky, and always balanced with accountability and transparency. Now, this is as evidenced by our gold seal of transparency from GuideStar. All Clear's programs focus on the 4 areas of health: mental and emotional. And this promotes awareness, empowerment, acceptance, action towards mental health and emotional well being; physical health, mitigate the negative and physical impacts, promote optimal health and longevity; social and family, support long term healthy social and family lives; spiritual, share resources for those seeking spiritual, religious, or philosophical support. Now, the All Clear Foundation's objective is to improve the overall well being and life expectancy of first responders. They are committed to promoting organizations who build resources and create communities for them. They currently have more than 700 resources on their website that span over mental, emotional, physical, and psychological, family and social, and spiritual categories. The website also allows the user to be filtered by subcategory, resource type, responder type, or simply type in your own search in the text box. Narrow the list by using one or more filters and search terms that find what's relevant to you. Once the used uses the filters to search for resources that fit their needs, the information in the database is presented in easy to use format in order to be able to access the information easily. Check out All Clear Foundation's social media presence. And what this does is allows for easy sharing of information and reduces stigma in the community around mental health issues for first responders. Follow them on Facebook, LinkedIn, Instagram. Substance Abuse and Mental Health Service Administration, SAMHSA, samhsa.gov. SAMHSA is a division of the U.S. Department of Health and Human Services. The mission of SAMHSA is to reduce the impact of substance abuse and mental illness on America's communities. And while they're not an organization that is focused on mental health for a first responder, they do cover topics and resources that are universal. SAMHSA provides ways to find treatment, training practitioners, public messages, grants available for organizations, data that surrounds programs, substance abuse, and mental health issues, programs, current news, and publications. National Alliance on Mental Illness, NAMI.org. NAMI is another important general mental health resource that may not be focused on the needs of first responders specifically, but their organization could be vital to treatment for anyone facing mental health issues. Now, this is apparent in their mission, their vision, and their values. Their mission, what their mission is that NAMI provides advocacy, education, support, and public awareness so that all individuals and families affected by mental illness can build better lives. What is NAMI's vision? NAMI's vision, a world where all people affected by mental illness live healthy, fulfilling lives supported by a community that cares. What are their values? Their values include hope. They believe in the possibility of recovery, wellness, and the potential in all of us. Inclusion. They embrace diverse backgrounds, cultures, and perspectives. Empowerment. Promoting self confidence, self efficacy, and service to our mission. Compassion. Practice respect, kindness, and empathy. Fairness. Fighting for equity and justice. Little history on NAMI. NAMI began as a small group of families working together in 1979. Today, they are the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. As the largest mental health organization, they are associated with more than 500 local affiliates working in your community to raise awareness and provide support and education to those in need. NAMI relies on gifts and contributions to support their work. And this work is educating families, individuals, educators, to be an advocate for public policy tools and resources in all states. Listen through their NAMI helpline, providing information and support to those in need. And then lead. Lead through public awareness and fight stigma on a daily basis. NAMI has many resources that can be relied on for mental health treatment and services. Among them, there are different types of mental health professionals: psychotherapy, treatment during a crisis, mental health medications, psychosocial treatments, complementary health approaches, and brain stimulation therapies. Now, what can this information do? Well, this information can help someone facing mental health challenges by learning about and choosing the right mix of treatments, a support that will work for the recovery process. With a treatment team, any person suffering from mental health issues can develop a well rounded recovery plan. This plan may include resources from your department, counseling, medications, support, peer groups, education programs, and countless other strategies that work for the individual. In the end, the most important thing to remember when searching for resources in the face of mental health issues is this: though feelings of loneliness may come in the wake of dealing with mental health, you are not alone. There's an abundance of resources that are just right and hope for recovery. I want to thank you very much for joining me in these series of courses. Hopefully, you've been educated in how to speak to someone with a possible mental health crisis, how to ask the questions, and how to develop a team and support group so that we can all reduce the stigma of mental health and first responders and change the conversation. Remember, you are your best advocate.